Hi. I'm robo-Suzie and today I'll talk to you about varicose veins, what you need to know now. Also don't forget to check out the link below, to find out how I got rid of varicose veins fast and easy. I didn't believe it at first. But back to our topic. I'm finding the older I get the more outdated my so-called medical assumptions have become. Take, for instance, varicose veins. When I was growing up and sliding my slender, teenage toes into blinding white, go-go boots, a la Nancy Sinatra, my knowledge of and my reflections upon varicose veins were limited. Sure, I'd seen them, dark blue or purple veins, bulging like cords, on gams of all sizes and shapes on parents. And, somewhere, in my head I reached this conclusion: varicose veins happen, they exist, like death in Texas. You can't really do anything about them, except wear long pants and go swimming at night. But, after a friend of mine went through a successful procedure for this condition and I did some research, my medical assumptions, like Nancy's boots, took a much needed hike. So, if you want to flaunt your legs again, here's what you need to know now. Condition can be treatable. After some basic research, I spoke with Edward Mackay, MD, RVT, RPVI, a vein specialist in Tampa, Florida, and co-director of the International Vein Congress, IVC. My first question was, are varicose veins always treatable? Yes, to some degree, Mackay replied. Treatments for this type of condition are extremely common. And even more heartening, he said, nowadays, most procedures can be administered in an office setting and, depending on the treatment, the recovery time can be a matter of days with minimal or no scarring. Causes. According to Mackay, genetics are the largest cause of varicose veins. They run in the family and appear as you age. So, yes, you may be able to actually blame one or both of your parents for this condition. Longevity weakens your veins and their valves' capacity to pump blood, causing blood to pool in your veins, creating varicose veins in their younger siblings, spider veins, the smaller, inflated blue and purple veins near the surface of your skin. Another primary cause is pregnancy. However, varicose veins resulting from weight gain due to pregnancy and the necessary circulatory change that sends blood to the fetus usually disappear on their own several months following delivery. Risk factors. In addition to genetics, there are other factors that can increase your risk of developing this condition. These include obesity. Extra weight on your frame creates added pressure for your veins. Gender. Females are more likely to develop varicose veins, possibly due to hormonal changes such as those involving pregnancy. Age. Normal wear and tear on your veins and valves can start to appear in your 30s. Lack of movement. A sedentary lifestyle or standing for long periods of time can keep your blood from flowing as well as when you are moving around and changing positions. Symptoms. Varicose veins most often appear in your feet and legs, but they can also occur in your thighs and ankles. They may or may not be painful. If painful, the symptoms manifest themselves with itching around your veins, burning, throbbing, muscle cramping or swelling in your lower legs, increased pain after sitting or standing for long periods of time, skin ulcers and swelling around your ankles, fatigue. Possible complications. Complications can include, as noted earlier, ulcers near your ankles or varicose veins. These are typically painful and you'll want to seek medical advice. Varicose veins can sometimes, although rarely, result in blood clots which may appear as severe swelling. If sudden swelling appears, again, seek medical care quickly. Self-care. There are several things you can do to prevent varicose veins or keep them from worsening. These include, exercising regularly. Wearing compression stockings, yes, they're still around. Elevating your legs for short periods several times a day. Avoiding high heels. Changing your sitting or standing position regularly. Losing excess weight. Sticking to a low salt, high fiber diet. When to seek treatment. If your veins don't visibly improve and any pain persists, it's time to see your doctor. Treatment options available. There are several treatment options available. The most common treatments are sclera therapy and the catheter-assisted procedures, which include the RF laser and endovenous procedures, says Mackay. Here's a quick description of the typical procedures. Sclera therapy. In this outpatient procedure, your doctor injects a solution that scars and closes small and or medium-sized varicose veins. Ambulatory phlebectomy. Tiny incisions, needle-like punctures, are used to remove smaller varicose veins. This procedure is used for surface veins and is similar to vein stripping. Laser surgery. Lasers are utilized to close off smaller varicose veins. No incisions or needles are required and the veins slowly fade and disappear. Catheter-assisted procedures, more specifically, endovenous laser therapy and RF, radiofrequency ablation, procedures. A catheter or thin tube is inserted into larger varicose veins and the tip of the catheter is heated. When the catheter is removed, the heat causes the vein to collapse and seal shut. Endoscopic vein surgery. This is utilized in severe cases where skin ulcers are involved. Using a camera inserted in your leg, your doctor will close and remove veins through a series of small incisions. This treatment is not used extensively as this can be done less invasively via other procedures. Vein stripping. With this procedure, longer varicose veins are removed through small incisions in a typically outpatient procedure. This treatment is rarely used in favor of less invasive procedures with reduced recovery times. Factors determining treatment. What are the factors in determining the correct procedure? Per Mackay, in terms of endovenous and RF laser, a doctor may recommend one procedure over another due to anatomy, that is, the length and depth of the vein and whether it is tortuous, has many bends and turns, or straight. For surface veins, the size of the veins and the patient's preference typically determine whether sclera therapy or phlebectomy will be utilized. Latest developments. When asked about new trends, Mackay said, the intravenous, sclera therapy, and catheter-assisted treatments have exploded on the scene as the main techniques for treating this condition. They are done in the office under local anesthesia and are less invasive. Depending on how severe the condition is, patients can be back to their normal activities within days. The catheter-assisted procedures are so effective they are looking at them in terms of applications for blood clots. Typically, patients are given a blood thinner and the body is left to treat itself. With these new procedures, we would be able to break up blood clots in deep veins sooner, reducing the risk of possible long-term problems. In any event, with varicose veins, like any other ailment, be sure to find out the latest information. Because, just like footwear trends, treatments for medical ills continue to evolve and improve. That's it. Thank you. Please subscribe, comment and like this video if it was helpful. See you soon.